Hormonal therapy. Hormonal therapy includes different types of treatments that alter the pathway of testosterone in the body and ultimately deprive the cancer cell of this important element of tumor growth. There are different methods of hormonal therapy. Orchiectomy, surgical bilateral orchiectomy, surgical castration. Bilateral orchiectomy is a surgical removal of both testicles. The procedure can be done under general anesthesia, but is usually done as an outpatient under local anesthesia. An incision about 2 inches long is made in the scrotum, and the testicles are removed. Post-operative pain is minimal. Bilateral orchiectomy is a fast way of eliminating most of the circulating testosterone. It results in rapid improvement in the signs and symptoms caused by prostate cancer. The procedure is permanent, and the patient does not have to continually return for treatments. This is also the least expensive treatment for prostate cancer. The disadvantage is that a surgical procedure needs to be performed. Patients who have testosterone removed will all suffer to some extent from hot flashes, decreased libido, and some generalized loss of muscle mass. The major drawback is the psychological aspect of having the testes removed. Complications from orchiectomy are rare. Occasionally, a patient will have some bleeding into the scrotum after the surgery. This is called a hematoma. Occasionally, a wound infection will occur. The surgical wound needs to be checked for hematoma or infection approximately 1 week after surgery. No sutures need to be removed. Normal bathing can take place after 1 to 2 days. No long-term follow-up care is necessary. LH-RH analogs. LH-RH analogs interfere with the body's own LH-RH and result in a decrease in luteinizing hormone, LH, and in testosterone. Testosterone levels are reduced to a range similar to surgical castration, and therefore the treatment is known as medical or chemical castration. During the first week of treatment, testosterone levels rise, but then decline to castrate levels by the 3rd or 4th week. About 10% of patients will experience some increase in pain during the first week of treatment due to the initial rise in testosterone, and this is called flare. The two LH-RH analogs, leuprolide, Lupron, and goserelin, Zoladex, are equally effective, and the side effects are the same. Leuprolide is given by intramuscular injection every month. Goserelin is given under the skin of the abdomen. Side effects of LH-RH analogs include hot flashes, mild enlargement of the breasts, impotence, and decreased libido. Anti-androgens. Anti-androgens are drugs that interfere with the uptake of testosterone and dihydrotestosterone in the prostate cell. There are 2 types of anti-androgens, steroidal anti-androgens and non-steroidal anti-androgens. Flutamide, Ulexin, is a non-steroidal anti-androgen, not a hormone, that is approved for the use in combination with LH-RH analogs. This combination is also known as maximum androgen blockage because of the studies that suggest that the combination is more effective than surgical or medical castration in eliminating the male hormone testosterone from the cancer cells. Flutamide is given orally, 2 capsules 3 times a day, for a total dose of 750 milligrams a day. The side effects are modest, such as diarrhea, some abnormalities in liver blood chemistries, and occasionally a mild chemical hepatitis. Bicalutamide, Casodex, is another non-steroidal anti-androgen that is also used in combination with LH-RH analogs. It is given orally once a day. Its occasional side effects are mild diarrhea, breast tenderness, and mild hepatitis. Sexual potency and libido are, for the most part, maintained. Megestrol acetate, Meges, is a steroidal anti-androgen that blocks the effects of testosterone and dihydrotestosterone in the prostate cell. It also causes some reduction in the production of testosterone. Megestrol acetate has not been fully studied in prostate cancer. It is given orally 4 times a day. The side effects include mild feminization effects, such as enlargement of both breasts, fluid retention, mild nausea and vomiting, and blood clots in the legs, which may dislodge and travel to the lungs. Cyproterone acetate, Androcur, induces similar action and side effects as Megestrol acetate. It is not approved for use in the United States. However, it is extensively used in Europe and Canada. Estrogens. Estrogens are female hormones which have been used for many years in prostate cancer. Estrogens are thought to inhibit the secretion of luteinizing hormone and consequently suppress testosterone production. While their benefits are comparable to castration, estrogens are not commonly used in prostate cancer because of side effects, some of which could prove fatal. Common side effects are breast enlargement with nipple tenderness, fluid retention, blood clots in the leg veins which may dislodge and travel to the lungs, heart attack, angina, and strokes can be seen in men over age 75 or in men with a prior history of cardiovascular problems such as high blood pressure, coronary artery disease, or prior history of heart attack. Estrogens should be avoided in such men. The most commonly used estrogen is DES, diethylstilbestrol, which is given orally 1 to 3 milligrams a day. Higher doses may be associated with a higher incidence of side effects. Diethylstilbestrol phosphate, stilfosterol, is a synthetic estrogen which can be given orally or intravenously and has similar effects as DES. Ketoconazole. Ketoconazole, Nizoral, is used primarily to treat fungal infections in the skin, but it has also been shown to be effective against prostate cancer. The most common side effects of ketoconazole are nausea and vomiting, and mild damage to the liver. It occasionally requires simultaneous replacement treatment with steroids since it affects the function of adrenal glands. Aminoglutathamide. Aminoglutathamide citridin also works on the adrenal glands, preventing the formation of testosterone. It is given orally 2 to 4 times daily and frequently requires the concomitant use of replacement doses of steroids. Pros and cons of commonly used hormonal treatments. Treatment. LHRH analogs. The advantages are, it's effective, non-surgical, and safe. The disadvantages are, the need for monthly injection and cost. Treatment. Orchiectomy. The advantages are, it's inexpensive, one-time procedure, effective, and safe. The disadvantages are the minor surgical procedure. Treatment. Estrogens. The advantages are an oral pill, inexpensive, effective. The disadvantages are its feminizing and the cardiovascular risk. Treatment. Medical surgical castration and anti-androgens. The advantages are, it's possibly the most effective and safe. The disadvantages are the cost. Chemotherapy. How chemotherapy works. How chemotherapy works. Chemotherapy is a generic term for drugs that kill cancer cells. There are many different chemotherapy drugs, and they act on cancer cells in different ways. There are specific drugs and drug combinations for specific cancers. Chemotherapy drugs can be given intravenously or by mouth, and are usually given by a medical oncologist. Once the drugs are in the system, the drugs travel throughout the body and destroy cancer cells. Chemotherapy is usually given when there is evidence that the tumor has spread to other parts of the body. Cancer cells frequently develop resistance to one type of chemotherapy, which should prompt the use of a different type. Some tumors are resistant to most of the commonly available chemotherapy drugs. Prostate cancer is not particularly susceptible to chemotherapy. Most commonly available drugs have either none or only modest effects against prostate cancer. For most cancers, one of the most important goals is to maintain a good quality of life. The use of potent chemotherapy drugs, which produce frequent side effects, needs to be weighed against the possible benefits. In prostate cancer, the side effects clearly override the modest benefits achieved with the available drugs. Thus, routine use of chemotherapy is not indicated. Estramustine, MSIT. Estramustine is given by mouth 3 to 4 times a day. It should be taken with meals to reduce gastrointestinal upset. Nausea, vomiting, and diarrhea may occur. It may aggravate heart failure in patients with a history of heart disease. It may also cause blood clots in the legs, heart attack, and strokes. Estramustine may be given together with other chemotherapy drugs. Suramin. Suramin is an experimental chemotherapy which has shown encouraging results in patients with advanced prostate cancer. Suramin is given intravenously a few days each week for 3 months. Side effects of Suramin include malaise, fatigue, tingling and numbness in the fingers and toes, skin rash, blurred vision, and mild kidney failure. Vinblastine. Vinblastine is commonly given together with estramustine. It is given intravenously once a week. Vinblastine can cause lowering of blood counts, constipation, and abdominal pain. It can also cause tingling and numbness in the fingers, headache, jaw pain, soreness in the mouth, and rashes. Etoposide. Etoposide is commonly given together with estramustine. It can be given intravenously or by mouth. Etoposide can cause mild nausea, vomiting, and anorexia. It can also cause hair loss, headache, fever, and low blood pressure. Spasm and wheezes of the airway have rarely been reported. Other therapy. Strontium. Strontium, metastron, is a radioactive substance that is used to relieve bone pain. Strontium is available in a solution form that is injected into the veins. It is selectively absorbed by cancerous bones, and because of its very low energy radiation, is concentrated only in the cancerous tissues. The effects of strontium are confined within the body. Isolation is not necessary since other people will not be harmed by bodily contact. Strontium is excreted by urine. It is important to avoid things contaminated by urine. Pain relief generally starts in 2 to 3 weeks following the injection and may last for a long time. about 15 to 20% of patients may have worsening of pain beginning 1 to 2 days after the injection, lasting 2 to 4 days. This usually indicates a good response to the treatment. Hospitalization is not necessary, and patients can continue their daily routine without any restrictions. A slight drop in blood counts is the only side effect of this treatment. Treatment choices: local versus systemic treatment, prostatectomy versus other treatments, watchful waiting versus treatment, early versus delayed hormone treatment, maximal androgen blockade, intermittent androgen blockade, treatment for elevated PSA.